Today in class, we're going to cover 9.NPA 4.2 content, and we have a PowerPoint to go over, and then, like I said, these vocabulary words, I will hit the main ones that we don't cover in the PowerPoint once I'm finished, because these are heat cramps, heat stroke, frostbite, frost nip, hypothermia are super important for your assignment. But going forward with the PowerPoint first, because we will cover some of them in this PowerPoint, we will start there. And of course, we've talked about physical fitness. We've talked about creating a fitness plan at this point. Now it's trying to make sure that we exercise safely and we avoid injuries and listen to our bodies when things happen. So our vocabulary word, like I said, this time is frostbite, hypothermia, overexertion, heat exhaustion, heat stroke, muscle cramps, strains, and sprains. So the key is, of course, we don't want to get injured. No one wants to get injured, but remember, accidents do happen. And some things, like I said, no matter how many safety precautions we have, sometimes, unfortunately, an accident cannot be avoided. But when you become ill or injured during physical activity, we want to approach the right steps to get help so that we can get this injury and illness cleared up as fast as possible so that we may continue our fitness goals. So of course, before beginning a physical fitness activity program, it's always a good idea to have like a medical screening or a physical to make sure you don't have any underlying conditions that would make it unsafe for you to participate in certain activities. So of course, using safety first when you're doing any kind of exercise or using any fitness program, you want to use correct safety equipment for an activity, pay attention to other people, objects, and the weather. Play or exercise at your skill level and know your limits. Warm up before you exercise and then cool down afterwards. Of course, stay in the areas designated for a certain activity. Obey all rules and restrictions, and of course, always practice good sportsmanship. Using the right equipment, of course, wear well-fitting athletic shoes that are designed for your sport or activity. Wear socks that cushion your feet to keep them dry. And of course, use comfortable, non-binding clothing that is appropriate for the weather and your activity. And of course, like, for example, using the cycling equipment or like biking, make sure you always wear a helmet that fits properly. Make sure your helmet is approved by SNEL or ANSI. And of course, use your front and rear reflectors if you ride like a bike at night. And of course, wear a light colored reflective clothing so that people can see you. And of course, like with skateboarding, and I know some of you skateboard after school, make sure you have your helmet, your elbow and knee pads, gloves, and wrist guards. So you want to make sure, like I said, when you have contact sports, if you're a male, wear a cup to protect your groin. Of course, for non-contact sports that involve running, of course, wear an athletic support. For females, of course, you always want to wear a sports bra and adaptive equipment. For those that have disabilities and take part of a variety of sports, if there is a special need from things like bowling to golf to help them be successful. And of course, using the right equipment can protect you from injury during your physical activity. So, and of course, checking the weather, especially if you're exercising outside. You want to be very cautious when you're doing like exercising in extreme weather, like thunderstorms in the summer or really cold temperatures in the winter. So like if you're outside and it's super cold, you want to make sure you have the proper materials on, like your hat, the base layer, an insulating layer, an outer layer, and even gloves to keep your hands warm. So cold weather risk, of course, warm up and cool down. Even in the cold water, you want to still drink plenty of fluids because the cold air can also lead to dehydration, not just warm air. Of course, cover your nose to prevent breathing super cold, dry air. And of course, if you have asthma, you need to talk to your doctor about exercising outside in the cold before you do so. In the extreme cold temperatures, you can get frostbite. And if you get frostbite, of course, you want to go to a warm place and thaw the affected areas with warm water, not super hot water, because frostbite is damage to the skin and tissues that is caused by the extreme cold. Hypothermia can also occur during extremely cold temperatures, especially if somebody is submerged in cold water or wearing wet clothing in the cold in windy weather. And of course, hypothermia is a dangerously low body temperature. And of course, heavy sweating while exercising in hot weather can lead to dehydration, excessive loss of water from the body, and you want to make sure you drink plenty of fluids before, during, and after physical activity to prevent getting dehydrated. So if you're exercising during extremely hot weather, you need to, of course, replace minerals like sodium, chloride, and potassium. So like a Gatorade or a Powerade would be a great drink to, a good drink to drink while you were exercising in extremely hot temperatures. And of course, when you exercise in the hot weather, you can overexert yourself, and that is when you overwork the body. And of course, overexertion can lead to heat exhaustion, and heat exhaustion is a form of physical stress on the body caused by overheating. And then if you don't listen to your body, of course, heat exhaustion, you start sweating, heavy sweating, cold, clammy skin, dizziness, confusion, and even fainting, a weak and rapid pulse. You have cramps, shortness of breath, and nausea and vomiting. So to recover from heat exhaustion, you want to make sure you get in a shady area, douse yourself in cold water, and fan your skin. And of course, if you still don't soon feel better within a half an hour, you're going to need to seek medical help because you could be at risk for a heat stroke. And a heat stroke is when the body, of course, is a dangerous condition when the body loses the ability to cool itself because you stop sweating, so the body just gets hotter and hotter. And when you are in the sun and wind, of course, you can be windburnt, sunburnt, and you can put yourself at risk for skin cancer and even eye damage when you are out in the sun and the wind. So, of course, like I said, unfortunately, sometimes when we are playing sports, when we are physically active, sometimes minor and even major injuries occur. Even when we don't necessarily do anything wrong, it's just, like I said, accidents happen. But like I said, minor injuries could be blisters, muscle cramps, strains, and tendinitis. Of course, blisters are a fluid-filled bump caused by friction. So like I said, if you wear very well-fitting shoes and proper athletic socks, you can prevent injury, blisters. And then, of course, muscle cramps occur a lot of times when the muscles are tired, overworked, and when you're dehydrated. And muscle cramps can be painful because they're sudden, sometimes painful contractions of the muscles. And then, of course, warming up before exercises reduces your risk of strains, which a strain is overstretching or tearing the muscle, which can cause pain, swelling, and difficulty moving the affected muscle. And of course, minor injuries also involve, like if you move a joint after you get a sprain is when you injure the ligaments around a joint, and it could be pain, swelling, and stuff like that as well. So when you have minor injuries, you want to use the PRICE antonym, and PRICE stands for protection, rest, ice, compression, and elevation. And the PRICE procedure, of course, you want to protect the affected area with a bandage or splint to prevent further injury. Rest the muscle or joint for at least a day. Depending on if it's major, you may need to rest it for more than a day. Ice the affected area for 10 to 15 minutes at a time, at least 3 times a day for 2 to 3 days after the injury to help with swelling. And it will also compress the area because it will reduce the swelling as well. And then elevate the injured area above your heart if possible to keep swelling down as well. Another minor injury is tendinitis, and that is the inflammation and swelling of your tendons, which are the bands of fiber that connect your muscles to the bones. So the treatment for that a lot of times maybe just be rest, some medication, physical therapy, and of course in super rare cases and severe cases, it may require surgery. Major injuries that are going to require immediate care, of course, are any fractures that are broken bones, dislocations, and when a bone pops out of its normal position in a joint. And then a concussion, of course, is any injury to the brain that can result in a severe headache, unconsciousness, or even memory loss. And of course, remember, concussions can vary in severity. You have taken, of course, an NFHS course on this about concussions. So if you have any questions about this PowerPoint, of course, let me know. And then I told you we need to go over, like I said, we went over heat cramps We went over heat exhaustion in the PowerPoint. We went over heat cramps in the PowerPoint, heat stroke in the PowerPoint, frostbite, but we did not go over frost nip. And frost nip is kind of what happens before frostbite takes place. And that is a red and usually pink color to the skin and numbness, which can be itching and tingling in the area. And to prevent it, just make sure you cover all areas of your skin and you wear warm clothes. Like I said, so frost nip is going to occur before frostbite. Frost nip, of course, can be easily reversed because you haven't lost the feeling in the skin, and you haven't lost blood supply. So it may be it may be painful. It may feel numb, but get inside to a warm spot, warm yourself up, and frost nip, like I said, can be easily reversed. And of course, we went over hypothermia in the PowerPoint as well. But if you have any questions, of course, please let me know, and I will be glad to help you.